Good afternoon, everyone. Thanks, Liz, and thanks, Adam. I have a bone to pick with Adam because he's actually twisted my hand to actually do this. He told me there was going to be about 15 people. If I knew there was going to be this many people, I would have said no, but yeah, we'll see how it goes. I came in a bit late, so I don't know what people have said before me, so if I repeat something, please forgive me. Yeah. When Adam called me and asked me to speak about smoking and diabetes, I thought, what do I know about smoking and diabetes? Let's see. Well, I used to be a smoker. I stopped smoking Adam doesn't know this, I stopped smoking about 20 years ago. And my mum's a diabetic as well. Talking about my mum, let me just tell you a story about my mum. I was dropping off, because she lives in America, and I was dropping her off at the airport the other day. She's not very good at managing her diabetes at all. And so I said to her, because my sister's been complaining, because she lives with my sister in America, and my sister said, can you have a word with her, because she might listen to you because you're a healthcare professional. So I said to Mum, Mum, I started having a chat with her. She just stood still, looked at me, and just walked away and said, "Stupid boy." I was quite shocked. I asked her, why? And she says, we're all going to die one day anyway. That's the attitude. Well, I mean, she's in her 70s, but that's the attitude. So I'm going to talk about smoking and diabetes. There might be people in here who probably have the attitude of my mum. But all I'm going to say is, I'm just giving you the information and then you do what you want with the information. But I think, if some of the information sinks in, it might really help you. So Adam tells me I've got 15 minutes to do this. Well, probably got 10 minutes now after my long introduction. So, all right, smoking and diabetes. First of all, let's start with some statistics. I just want you to have a look at the picture. This is from 2011, so I presume this is information from the previous year. HIV, 529 people were killed by HIV and HIV-related diseases. 648 murders. Traffic accidents and traffic-related deaths, 2,946. Suicide, 5,377. Alcohol, 8,724. Obesity, 34,000, and smoking is 81,400 people died from smoking. I mean, compare that to HIV. We do hear a lot about HIV in the news, don't we? HIV, we hear about murders and stuff like that, but that's more than, well, how many times? You do the maths. just work it out. That is a lot, isn't it? And I think, we need to really do something about this. Just to give you some figures, and at the moment, this country is very interested in figures. We're not at the fiscal cliff yet. But the NHS spends about between 2.7 and 5 billion a year treating smoking-related illnesses. That's a lot of money. I know there are people who talk about the fact that, well, smoking brings in a lot of taxes, and it's estimated it brings in about 10 billion to the Chancellor of the Exchequer. But what people don't actually talk about is the social cost of smoking. Now, if you work it out, of people having treatment in the NHS, all types of other diseases, even cleaning up the streets from cigarette butts, that cost about 14 billion. So there's a net gain of minus 4 billion. So when people talk about the fact that we get 10 billion from taxes, that's only half of the story. It doesn't give us a full picture. So we have an issue at hand. Let's look at some health risks of smoking. I think a lot of these diseases are quite popular. We've heard about them. We're talking about strokes, cancers of the mouth, throat and esophagus, cancers of the larynx, coronary heart disease, chronic obstructive and pulmonary disease, lung cancers, pancreatic cancer, ulcer, bladder cancer, cervical cancer, low birth weight babies, and peripheral arterial diseases. Why do we have these diseases? Is because cigarettes actually contain about 4,000 carcinogenic agents. Sorry, 4,000 chemicals, and about 70 of them actually cause cancers, and that's where we get all these cancers from. So so far, cigarette doesn't look very good, does it? Now the problem is even compounded if you have diabetes. So now let's look at smoking and diabetes. For diabetics, smoking can be even more damaging than for the general population. And why is that? Because one, smoking raises blood pressure and blood sugar levels through vasodilation, and the fact that, so the chemicals can actually have an influence on your blood sugar level. It also increases the complications for diabetics through heart disease, strokes, and poor circulation. So first of all, let's look at how smoking increases the heart disease, or increases heart disease for diabetics. We have a high level of glucose in the blood, which changes the composition of the artery walls, and therefore increases the chances of developing fatty deposits in the arteries. Now there's binding in there as well, which means that carbon monoxide also increases fatty deposits by binding to the hemoglobin in the blood, which leads to less oxygen and therefore less circulation. Stroke. The general population itself is susceptible to diseases and illnesses like stroke, but if you are diabetic, that's also a risk factor as well. Smoking actually doubles your chances of suffering from a stroke as a result of the risk of blood clots forming, which is significantly increased through the damage to the lining of blood vessels, through stickiness of platelets, your increased blood pressure and heart rate. Those are all things that lead to strokes. We've already talked about your vessels constricting as a result of smoking, and therefore leads to poor circulation. Diabetes is actually the main cause of, or most common cause of peripheral vascular disease, and smoking is also a risk factor with regards to peripheral vascular disease. What that leads to is reduced blood supply, which leads to sores and ulcers on feet and toes and risk of gangrene. Smokers also have an increased risk of developing cataracts, and I'll talk about that in a minute, especially to do with cataracts. Now, what happens here is that oxidation and precipitation of lens proteins takes place as we smoke. The tobacco smoke itself may alter our plasma concentrations in our eyes, and nutrients which are essential for lens transparency gets affected as well. So what that means is diabetic patients that smoke are at a risk of cataracts and other ocular complications. Now, personal family experience, my granddad, before he died, was blind as a result. He was diabetic and he smoked as well, and it was proven that that was the cause of that. So I have a personal family experience. Smoking is also associated with neuropathy. Statistics show that smokers are 2.2 times more susceptible than people who do not smoke. When we talk about neuropathy, one of a type of neuropathy is actually erectile dysfunction. Studies in America have shown that 23% of cases of erectile dysfunction are due to smoking. And patients who have diabetes are at high risk for erectile dysfunction. And also patients that smoke are at high risk of erectile dysfunction as well. So what that means is if you're diabetic and you smoke, that's double jeopardy. You're basically doubling your chances of erectile dysfunction. Going back, sorry about that. I don't know how that came so right, but if you're a smoker, you actually have 1 in 2 chances, or 1 in 2 smokers will die due to smoking. We're all going to die anyway. But if you're a smoker, then your chances are even higher. And if you're diabetic as well, that also increases your chances of dying prematurely and as a result of complications from your disease. So this is my little information for you. Just like my mum, you can actually say to me, "Stupid boy, sit down." And I will gladly sit down. Thank you very much.
Does anybody have any questions, Giles? I think you've stunned them.
I've stunned them.
No one's going to admit to smoking, I don't think, in the room now. Hold on one second.
If one stops smoking, and then if one stops smoking in intervening years, do the risks decrease, or depending on the number of pack years, as they call it, is that more significant than the longer it is?
It's never too late to stop smoking. Any time that you stop smoking, it actually increases your chance of survival and developing some of these things that we've talked about anyway. So you can always do something about it. It's never too late.
Wonderful. Well, thank you very much. That was an excellent talk.